You're probably watching this if you have a pinched nerve in your neck and you're trying to figure out how to truly fix it, right? Maybe you had it from a car accident from a while ago. Maybe you woke up with it one day and it's degenerative, right? Doesn't matter how, this will help you fix that issue. So pay attention, get a notepad out. This is Dr. Corey here from Choffner Rehab and Recovery, and we help reassess people and kind of pick up where traditional PT left off with them with rehab and recovery. And we help them as weightlifters get back to their 100% because most get to 60 to 70. They can't quite get that last 20 to 30%. We help take you from point A to point B. Okay, so tonight's topic is advanced treatment of a pinched nerve in your neck. All right, so with that being said, we'll dive into the topic. And if you didn't see last week, this is our series of 4 videos for this month. Go back and watch it because we talked about step 1 in the treatment of your neck pain that had to do with putting you into a certain specific category that's going to dictate your treatment. So if you haven't seen that, watch that first. Otherwise, this one's not going to make sense. This is step 2 of treatment, right? Last week was step 1. We talked about nerve gliding, stretching of the neck muscles like your upper traps and your levator scaps. The names don't matter. Don't worry about that. We also talked about mobilizing the cervical and the thoracic spine in detail, aka moving it. Mobilizing is a fancy word for moving it, having a therapist work on it a little bit. And there's some techniques you can do on your own too. Go back and watch the video. And today we're going to dive into 3 things, right? Mobility of your neck and mid-back. Number 2 is strength of your deep cervical neck flexors here in the front. And number 3 is coordination or motor control. And don't worry, I'll explain more about that third one because it gets a little bit kind of confusing. All right, so why are we talking about this? Why are we starting with mobility? As you saw last week in our video, mobility and nerve gliding are super important to do first. You have to have good mobility and flexibility before you move into strength. Otherwise, it just doesn't really work out, or you're going to end up in more pain and you're going to delay your recovery process. This is the way it has to go. And this is based on research, based on me working with patients in the past, and based on how they feel from this. Okay, so mobility of your neck and mid-back, we're going to talk about 2 exercises. Number 1 is neck CARs, also referred to as CARS, right? Controlled articular rotation is what it stands for. All it means is taking the joints through a full active range of motion. And number 2 exercise is bench thoracic extension mobilizations. All right, then if we move into strength, we'll talk about strengthening these muscles called the deep cervical neck flexors, and we'll talk about that through supine, aka laying on your back, chin tucks with the rotation. And then the third thing for coordination and motor control, we'll talk about deep cervical neck flexor endurance, okay? It's a bit of a mouthful. So those are the 4 exercises for tonight. I almost said 3, can't count. So I'm going to share my screen and we're going to go through those 4 exercises that you guys can use to help you skyrocket your progress as you heal and recover from this nasty pinched nerve in your neck. And I do have to say, if it doesn't get better after 4 to 6 weeks, we're going to talk about what to do if that does occur. Because sometimes that does occur, guys. And don't blame your therapist if that does happen. It just means the issue anatomically is more serious than we previously thought. And there's not a true way for us to know besides some special tests we do, seeing how you respond to treatment, and then also a little bit of imaging mixed in between there. So let's share screen here. Give it a second to load, guys. All right, so you should be able to see my screen here. First exercise I'm talking about is neck CARs. Again, controlled articular rotations. Don't worry about that. We'll make this bigger. All right, so what is this? You can hold 2 dumbbells here if you want to drag your shoulders down, because most people tend to be too tense here, but you want to make sure your shoulders stay pinned down. You can see the kind of little clockwise direction of the arrows here. This is the positioning of your head, right? Imagine you're holding 2 dumbbells, shoulders stay locked down, and you're just going in a big round circle, right? Going into flexion here, side bend to the right, then extension all the way back, and you're repeating that pattern. So I'll typically have people do 10 reps in a clockwise position, then switch and do a counterclockwise position for 10 reps. And you want to move super slow, methodical, and controlled. That is probably the most important thing as you do it. Okay, so that's number 1, really simple, easy to do. You're going through all 4 ranges of motion of the neck, so you're fully working those vertebrae and the muscles surrounding it. All right, next exercise, this is for mobility as well. This is the last one for mobility. It's going to be bench thoracic extension mobilization or movement with hands behind the head. And I like this one because you're not going to stress the neck because your head stays in a neutral position. So all you need is a bench. If you don't have a bench, you can use the end of a chair. That works just as well, or your bed, if the bed's low enough to the ground where it's like 3 to 4 feet off the ground. Not a bed on risers. All right, all you're doing here is sticking your butt back, letting your low back arch slightly, and your hands are behind your head with your eyes looking straight down. So I come back into the stretch and I hold it for 3 to 4 seconds. It's a temporary dynamic hold, and I'm doing about 12 to 15 reps. Okay, you can do 2 to 3 sets on this one. Really good to open up that mid back and also not stretch the neck at the same time. And you might even feel a little bit of a stretch in your lats here on the sides. All right, so give that one a go, super easy. And that'll wrap up our mobility section. All right, and then we get into some of the better stuff here, strengthening. Okay, this is an advanced movement. Looks really easy. Could be hard if you're dealing with neck pain or you're struggling and you have a lot of weakness in your neck. This is going to be to strengthen your deep cervical neck flexors, our second category here for tonight. So you want to use a nice little ball under your head. You can use a towel roll. A pillow works fine as well. A ball's nice. This is like a little ball you would buy for your son or daughter if they're of young age, right, that they would play around with in the yard. And you're just deflating it a little bit so there's a little bit of air out of it. And you're doing a chin tuck into the ball, holding the chin tuck, rotating to the left, rotating to the right, coming back to the middle and relaxing. You don't want to do too many reps on this one because it's going to fatigue quickly. 8 to 12 reps on average, 3 sets. Okay, and one repetition involves a chin tuck, full rotation to the left, and full rotation to the right. And then when you come to the middle, you're going to reset. All right, so you want to make sure you chuck your chin by making a double chin, hold for 2 to 3 seconds as you rotate side to side. Right, really simple, really effective. Again, 3 sets helps. You guys can take little breaks between your sets, usually 40 to 60 seconds. That's the most ideal. So that's strength. If you guys have questions, please put them down below in the comments. If you're watching on Facebook or on YouTube, same thing. And we'll have a little bit of a gift for you guys at the end. So make sure you stick around. We're almost done here. We have about a couple more minutes, one more exercise to review. These are for motor control and coordination. What is motor control and coordination? It's pretty much teaching our muscles skill. Right? Like when we play a sport as an athlete, we have to learn certain skills. Yes, you need the required prerequisite mobility and strength to do that sport and do it well, but you also need to practice the skill. Like take learning for golf, for example. You have to have good flexibility in your mid back, your lower back, and your hips, right? Then you have to give good strength to hit the ball hard and far, but you need to practice the skill of the actual fluid movement of the swing. This is the same thing with your body. After you get good mobility and strength, you have to practice the skill, meaning like endurance and hold times for those muscles. All right, so this is strengthening these muscles again. All right, your deep cervical neck flexors, and you want to do a chin tuck here, and then lift the head up about 1 to 2 inches off the floor and hold for 10 to 15 seconds. So you can see I have a nice double, maybe even a triple chin here. Right, this is a while ago. I think I've lost a little bit of that. I also have a beard now. But anyways, that doesn't matter. Chin's going down to the chest slightly. My head's up, very hovering just above the ground. I don't want to be way above the ground like this, right? That's going to irritate your neck. This one you should feel under the ears here in this area of the neck. And again, you're holding 10 to 15 seconds and you're doing 2 to 3 sets of 3 to 5 repetitions, right? You don't want to do too much with this one because you can overdo it. I'm going to play that one more time. Chin tuck, right? You can use your fingers there to cue it and then a slight lift off. Right, my back is also flat and my abs are lightly engaged. So try that. Try to make sure the shoulders remain relaxed and don't leave the ground as well. All right. Perfect, guys. So that is it for tonight. Those are the exercises. So just to recap, the things that we went through, we talked about mobility for the neck and the mid back through those 2 exercises, the neck cars and bench thoracic extension mobilizations. We talked about strengthening through chin tucks and rotations and coordination and motor control through the deep cervical neck flexor endurance. So now we should know steps 1 and 2 in your treatment on how to fix your pinched nerve once and for all. And again, it could have happened from waking up one day, from over time, from degeneration, or it could happen from a physical accident or trauma. It doesn't matter. This should help. Give it 4 to 6 weeks in total of doing this on your own or working with a therapist, right? Usually the combination of working with a therapist and doing stuff on your own at home helps a lot. Sometimes you have to pull in medications or injections, but if it doesn't get better in that time frame, you should get approved by insurance, to get you into the doctor's office to see your primary care physician or your orthopedic doctor to get an x-ray, number 1, or get an MRI to show exactly what's going on. And just be aware, guys, most people have disc herniations in their spine. It's not abnormal, but they don't present with pain. Okay, so if you have a small herniation, that's okay and that's normal, right? If you have a pinched nerve, that's a little bit different. That's abnormal, right? So that's the easiest way I can put it for you guys. So thanks so much for watching. Be sure to like and subscribe to our YouTube channel. Comment neck down below if you guys want our free guide with these exercises on how to fix that pinched nerve in your neck you've been dealing with. All right, thanks guys so much for watching, and we will see you next week for a new topic.